Yeah.
So basically, what she has is, she has lipedema, obviously, going on with the leg. And she's having some numbness as well as immobility due to this. And the reason that's happening is because you have too much tissue in this compartment of your leg. Too much tissue in a small compartment causes compression of the nerves, and that's what's causing your pain and numbness in this leg.
Okay.
You also happen to have venous insufficiency, which is blood not returning to your heart as well as it should. That's probably a result of you having children. And it also happens very commonly with lipedema. It sounds like your more pressing symptom right now is related to lipedema, not the venous issues.
Right.
Your leg cramping at night is almost certainly related to vein problems. Your numbness and immobility is mostly related to the lipedema. So we will address the lipedema first as a result, okay?
Perfect.
Sound good?
Alright.
So,
the cost is it is $10,000.
That includes
Per
the
person.
anesthesia, my surgical fee, the
Right.
fee for the surgical center,
Right.
and includes a therapy fee pre and post-op.
Okay. Now, when we do this with us coming out from where we live, we're from Ontario, do I have to come back for visits after the procedure with you? Like, would I be staying here for a little bit to...
I typically ask people to stay about 2 days after the procedure, and the reason is we want to check you, especially if you're going to travel,
Right.
we want to check you to make sure everything heals up okay,
Right.
even for the first 2 days.
Okay.
And we will also want to check you for DVT, which is the most common complication after elective surgery in otherwise young, healthy people.
Right.
And that's a blood clot in your deeper veins. We want to make sure that you don't have that before you travel as a safety precaution, okay?
All right. Perfect. And then do I have any post-op when I go back to where I'm to Ontario? Do I have to follow up with someone there? Or?
You don't have to. Typically I see you about 3 months afterwards unless you're having some pressing issues to reevaluate. There is no cost for that appointment.
Okay.
We just see you just to see how you're doing and to rediscuss progress, etc.
Okay. Okay, perfect.
okay.
So is there any paperwork that I would need to fill out, or can I bring, is there anything I can bring home to?
What I'm going to do is I'm going to discuss, I'm going to dictate a consult about what I found, what are the medical indications, what is the rationale, what's your other comorbid disease, which is venous disease.
Right.
Anything that you would basically need to basically give to your insurance providers ahead of time,
Okay. Okay.
and that would be it.
Perfect.
Okay?
All right.